My name is Lexi Stinson, and I chose to do my report on Parkinson's disease because my grandpa actually has it, and so it just kind of hits close to home. I was curious to find out more about it and understand what he's going through even more. Parkinson's disease is a neurodegenerative brain disorder that progresses slowly in most people. Most symptoms take years to develop, and they live for years with the disease. For a person with Parkinson's, their brain slowly stops producing dopamine. With less and less dopamine, a person has less and less ability to regulate their movements, body, and emotions. When approximately 60 to 80% of the dopamine producing cells are damaged and do not produce enough dopamine, the motor symptoms of Parkinson's disease appear. Around 1 million people in the United States suffer from Parkinson's disease. Majority of cases are in adults over the age of 50. Parkinson's disease is not fatal, but complications from the disease are serious, and they are considered to be the 14th top cause of death in the United States. For many years, there has been research conducted to discover the cause of Parkinson's disease, but unfortunately, no one has really found an answer. Many experts believe that it is caused by both genetic factors and biological factors. The majority of cases are not caused from inheritance. Only about 15 to 20% of people with Parkinson's disease claim that they have a family member with it as well. Research shows that if an immediate family member suffers from Parkinson's disease, then it is more likely that that person will also have Parkinson's, but the chance is only 4 to 9% higher. There are a couple of famous celebrities that suffer from Parkinson's disease that people know really well: Michael J. Fox and Muhammad Ali. Because both of the celebrities have tremors and shake, most people believe that it is the case for all people with Parkinson's disease, but that's not the case. There are 4 main motor symptoms that help with diagnosing whether or not someone has Parkinson's disease. Resting tremor is the most common symptom that people experience when they are diagnosed with the disease. Around 70% of people with Parkinson's first experience uncontrollable tremor of their hand or foot. Sometimes an individual may experience tremors in their face or jaw, but that is much less common. Typically, these tremors will take place when a person's muscles are relaxed. Usually the tremors will start in just one finger, but not always. Although many people associate tremors and shaking with Parkinson's, not all people with the disease experience those symptoms. Bradykinesia is the second motor symptom that they associate with Parkinson's disease, which means slowness of movement. Many people with Parkinson's will have a general reduction of spontaneous movement, which can give the appearance of abnormal stillness and a decrease in facial expressivity. Bradykinesia affects someone's ability to perform repetitive movements, and an individual suffering from bradykinesia may struggle to perform everyday tasks. They may struggle to do various things that appear simple, such as buttoning a shirt, cutting food, or brushing their teeth. People with bradykinesia oftentimes walk with much slower and shorter steps. Bradykinesia can also affect a person's speech. Therefore, someone with this symptom may have quieter and unclear speech. Rigidity is also another common symptom of Parkinson's disease. Rigidity causes stiffness and lack of flexibility. Typically, when a muscle moves, it stretches, but when it rests, the muscle becomes more relaxed. With rigidity, the muscles affected never relax, which can cause a decrease in range of motion. Rigidity can be uncomfortable and painful for individuals that suffer from it. Postural instability is considered to be one of the most important signs in diagnosing Parkinson's disease. Individuals with postural instability will oftentimes be unstable when they are standing. Postural instability can cause someone to lose their balance and fall because they are unable to hold themselves up. Some have trouble standing up from a chair and may lose their balance backwards, which can cause them to fall back into their seat. It can also be very difficult for people to turn and pivot if they have postural instability because of the lack of balance that they have. Therefore, they often move very slowly. As a side note, I've actually seen a lot of these symptoms in my grandpa, specifically standing up from a chair. He struggles to do that and oftentimes falls back, so he needs assistance to even stand up from the chair. He's very stiff. He can barely speak anymore. We can't really communicate with him. He oftentimes gives us a thumbs up or a thumbs down. If he says yes, it's a thumbs up. If he means no, it's a thumbs down, and that's how we're able to communicate now. So I've seen a lot of these symptoms with my grandpa. Since Parkinson's disease is not curable, the doctor's goal is to provide medicine and therapies that will allow the person suffering with Parkinson's disease to continue living as high of a quality of life as possible. Many people with Parkinson's attend physical therapy regularly to work on their strength, flexibility, and balance. They may also learn to complete everyday things such as sitting down in a chair or getting into a car. Some people have difficulty speaking because of the disease, so they see a speech therapist. Doctors may prescribe various types of medicine, such as one that puts more dopamine into the person's body so that they can hopefully have more control of their movements.